Today, a rare strain of Ebola and its trail of tragedy in the DRC and beyond.
Authorities in the DRC have warned that many people are dying at home and it's increasing the risk of transmission.
Why it's sparking protests in Kenya and what it means for global health as a whole. I'm Malika Bilal, and this is The Take. Hey everyone, before we go on with today's show, we want to hear from you. Remember to leave us a comment as you're watching this interview, telling us what you think about this episode and what stories you want us to do next. And if you're listening on a podcast app, you can leave us a review telling us where you're listening from, what you like about The Take, and feel free to give us a 5-star rating while you're there. It really helps other people discover the show.
My name is Catherine Soy. I am a correspondent with Al Jazeera. I'm based in Nairobi, Kenya. I cover East and Central Africa mostly.
Based in Kenya, reported recently from Uganda, and have been to the DRC reporting there for years. And so you were the perfect person to talk to about this story that is rapidly changing by the minute. Catherine, welcome back to The Take. It's really good to have you. Let's start with what is actually happening on the ground right now when it comes to the Ebola virus, because the numbers are moving fast. How bad is this Ebola outbreak?
Well, the situation is bad. I will not lie. We have been hearing from CDC, we've been hearing for World Health Organization, our correspondents who are in Goma reporting.
The WHO said Tuesday there have been more than 320 confirmed cases of Ebola and scores of deaths in the Democratic Republic of Congo.
48 deaths. Those are what is confirmed. And there are 116 deaths that are still being investigated on. So the situation is still bad. Health workers are struggling to just save these people. But it's difficult because this was detected so late. So they're fighting against time, really.
I read that health officials have said they believe this strain was circulating for weeks before it was detected. So what does that mean? How can that happen?
That is the biggest concern because we know that this spreads very, very quickly and it wasn't detected on time.
The response to the deadly and fast-spreading epidemic in the Democratic Republic of Congo is weeks, if not months, behind. After delayed detection, the major issue now facing the country is contact tracing. Only 7% of the thousands who may be at risk have been identified, and medical teams are racing to find them.
It started in a mining area. It's a very congested mining area that has many, many people. And one person died. This is the person that they are investigating. And then they buried this person. And then now it started spreading. And by the time the health workers, health officials realized that this is Ebola, like I said, was very, very late because they were testing another variant of that Ebola. They were testing Zaire strain. This is a relatively new strain. So health workers were not really concentrating on that.
And strain matters here, it sounds like. This isn't the Ebola most people picture from 2014 when we witnessed the most widespread outbreak of the virus in history. What is it about this strain that has people so concerned? What makes it different?
This strain originated from Uganda, Western Uganda, Budibunjo. That's a town where it originated from in 2007. There's not many studies that have been done on it. There's no vaccine. They have not researched on vaccines and things like that because they were concentrating so much on this Zaire strain, which is more deadly.
As Ebola sweeps through parts of the Democratic Republic of Congo, there's now a race on to develop a vaccine. The Coalition for Epidemic Preparedness Innovations, or CEPI, says it will give about $60 million to drug maker Moderna and 2 other groups. That's to fund development of a vaccine for the rare Bundibugyo strain of the virus, which is behind the outbreak.
Right. So you're saying the strain that many of us know about, even though we may not know the name, Ebola Zaire, there are vaccines, there are treatments, but this strain, not much research has been done, and thus there are no vaccines that we know about. And people are being treated, but there are deaths. So what is it that is making this outbreak different than the ones in the past when it comes to what communities are doing, how people are keeping safe, what health officials are doing?
These two countries, Uganda and DRC, have had several outbreaks between them, and they know how to deal with some such issues. But when it comes to, say, for example, DRC, there's a lot of mistrust. They have several outbreaks, not just Ebola. We have measles, we have Mpox. So we have all these outbreaks. And every time Congolese communities there say that, oh, these diseases have been brought to us by health workers, by these international partners who want to make money off of us. And we have seen attacks on treatment centers. We have seen, attacks on health workers when they're transporting bodies to be buried safely. We've seen this in this outbreak as well. We saw that in 2018 when there was a huge outbreak. A lot of people in the community were like, this disease does not even exist. And up to now, a lot of people in the community are saying this disease does not exist.
Bunia resident and opinion leader Luke Malembe blames poor public awareness for the spread of fear and rumors.
So, at that time, we were told there was a mystical coffin that comes at night, and that this was what was killing people. There were even neighborhoods in Mongaloo that started to empty out because people were dying in waves, and no one was able to tell people what had happened. So this lack of communication, this absence of communication from the health authorities in the province is what's allowed rumors to take over. And it is what continues to this day.
Others are talking about it's a curse. Others, because of the stigma as well, are hiding their loved ones not to go to treatment centers. Others are saying that going to a treatment center is a death sentence. So we'd rather stay home.
Oh, wow. Well, I know that you were talking to people along the border between DRC and Uganda recently in your reporting. It's normally this bustling area of commerce, a crossing with weekly border markets. But with this virus being present, things are different now. What was it like? What were people telling you?
And I have to tell you about that. I have to talk about the border in general. It's a porous border. We're talking about 19 kilometers. Some of it is porous. The health workers are concentrating on, obviously, areas that border Ituri. That is the epicenter. We know that currently the government of Uganda has closed that border.
Uganda is temporarily closing the border with the Democratic Republic of Congo with immediate effect. The only exceptions are for authorized Ebola response teams, the humanitarian operations, the food and cargo transportation, and security.
It has not happened before, even in other outbreaks. So the government is very worried about that situation. So we did go to the border and we spoke to people there. And many of them were not worried at the time. And they were saying that the government will protect us. The government has put in place all these measures very, very quickly. When the outbreak, broke out, Uganda just came in and instituted a lot of measures, including closing the border markets. And that was their big concern. The communities there, the people that we spoke to, they say that this is our bread and butter. So a lot of people at the border were more worried about how they're going to survive without these markets.
Well, you mentioned the epicenter being in the DRC and Uganda closing this border to prevent the spread. How close is this to spreading beyond these countries, beyond Central Africa?
Well, CDC issued a statement saying that 10 countries in the region are at risk of, a spread. That's Uganda, obviously DRC, South Sudan, Kenya even, and other countries bordering DRC. We spoke to our colleague in Burundi, who says that they have started putting these measures to make sure that there's no spread. They haven't closed the border there. Rwanda has closed its border as well. Kenya has put in place all these measures as well. And we also know that some of these countries, like South Sudan, which are very vulnerable countries, so South Sudan, Burundi, Uganda are working together when it comes to surveillance along their borders as well, because we're talking about countries that are very, very poor. They cannot afford to have Ebola in their countries because they do not have proper healthcare systems to control such a disease.
One thing that I keep reading in my research of this is from disease experts. When it comes to this outbreak, they're saying that there is a country that is missing from this response, and that is the United States. The U.S. helped lead the response in 2014, but with the administration of U.S. President Donald Trump dismantling of the U.S. Agency for International Development last year, USAID, that response looks different this time around.
I mean, a lot of people that I talk to, health workers, government officials, they say this will affect things because, as I said, some of these countries cannot afford to deal with this crisis by themselves. So a lot of help is needed. And with these donor cards, especially from the US, this is something that many African countries, many people that I have spoken to are worried about. We know that the US has pledged some money to help, but it's not enough.
Well, Catherine, I know you and your team also visited a virus research center in Entebbe in Uganda. What was that like? What did you come away thinking?
Yes. So that virus research institute is a big institute. It's a government-owned one. It has researchers who have dealt with infectious diseases for decades. And they were telling us that the biggest problem that they face is that everything was concentrated on the other virus, the Zaire virus. So there needs to be proper studies done on this virus to get a proper vaccine on it. But again, they were talking about there's no money. And especially now during, these donor cards, they cannot even start on the process because there's simply no funds.
Well, Catherine, there is an angle to this story that is unfolding where you are in Kenya, and that is around the U.S. response because it has been controversial. The Trump administration quietly struck a deal to quarantine exposed Americans in Kenya rather than bring them home, which is the common way to address this. What do you think was the thinking here, and how is that playing?
Wow. Everybody is angry about this situation, about that treatment center being set up in Laikipia in central Kenya, in Nanyuki. And we have heard from President William Ruto. He spoke to journalists just trying to say why this has been decided.
The agreement between the government of Kenya and the American government is for the good of our country and for the partnership that friends like the American government, have demonstrated to us over time. They have deployed huge resources. They've given us a grant of close to 200 billion Kenya shillings to support the building of our health infrastructure.
But people don't buy that. People are angry. I will talk to the taxi guy who's driving me around. My mother in the village, she'll be like, I don't want this. It doesn't make sense. You speak to health experts like doctors. They're saying, why? Why is this happening? Kenya has no case of Ebola. There's a civil society group called Captiva Institute that has now gone to court to block that setup of this treatment center. And the court has said that until this is heard, the government cannot do anything or even bring anybody who is exposed, any American who's exposed to that treatment center until the case is heard. And a lot of people are also saying there's no transparency at all. So it's not clear what this deal entails. For example, if a Kenyan gets sick, will they be taken to that facility? I don't think that's going to happen because it's an American facility. Maybe our military, the Kenyan military, will be able to benefit from that because it's in an air base and things like that. So people are saying, it's how is this going to benefit us?
Well, alongside that court ruling, we've also seen Kenyans take to the streets, showing their anger over this deal.
Hundreds of people marched through the streets of Nanyuki, Kenya on Monday, burning tires and blocking roads. Anger was directed at elected officials, whom residents say have failed to address their concerns about the facility.
What do those protests look like?
So more than, I think, 200 people took to the streets in Nanyuki, saying that they do not want that treatment center. It's a 50-bed, treatment center, and they're saying, please take it elsewhere. We don't want it here. We have children. We do not trust the system. What happens if, for example, a nurse who is going to be working with someone who's infected comes home, or there's a loophole? Then what? If this disease spreads beyond Nanyuki, where the treatment center is going to be, what's going to happen? Does Kenya have the capacity to deal with such an infectious disease? And that is what the court will be hearing from this petitioner, who's saying that Kenya does not have the capacity to deal with an outbreak that spreads so fast.
Well, Catherine, as we wrap up here, we mentioned the Ebola outbreak that many people around the world remember is the 2014 one, the largest outbreak in history, which came with heartbreaking story after heartbreaking story. You covered it. Zooming out, what does this current outbreak reveal about where we are right now in the fight against this virus?
The good thing, from where I'm sitting, is that people are getting cured. That's a positive to me. People are getting cured. We have seen in Uganda, people are recovering. Believe it or not, in DRC, people are recovering as well. I have seen people with their certificates saying that I'm Ebola negative. So that is the good news. The bad news for me is that I'm seeing this pattern repeating itself. So when I was there in 2018, 2019, in Beni, in North Kivu, and we were talking about the same issues when it comes to stigma, people trying to ban, health centers, killing health workers as well. We witnessed that, and people just running away from, treatment centers. This time, same situation. People are banning, residents are banning treatment centers. They're running away from treatment centers. They do not trust, health workers and things like that. So it's just the same situation. So I think that more needs to be done to sensitize communities that this disease has not been brought from elsewhere, that it's there. and it's killing them. And they can see that people are dying. So there needs to be more sensitization so people can get the picture that they're being helped. And for that to happen, then there has to be a lot of community meetings. They have to talk to people who, community members who are trusted. You can't just come to a place when you're wearing all these hazmat suits, and it's scary. I would be scared seeing all these, people dressed up like this. I mean, it looks like death, in those places. So, health workers really have to educate and sensitize communities. Other than sensitization, we are also talking about, their frustration. I mean, the people who are leaving this situation are also frustrated because they're being told, you have to wash your hands, sanitize, do this. All these things cost money. So we're talking about people who are so marginalized. They live in remote villages. They are poor. They cannot afford much. All they can afford is, food on the table for their children. And even that is not forthcoming. So a lot of people ignore the health measures that are needed to protect the families, because they say, do I buy food or a sanitizer? So that is the reasoning. So that's how everything is so complicated, because we have people who are saying that we cannot afford these measures that we're being told, so we will just pray to God.